My name is Erik Berglof. I'm the Director of the Institute of Global Affairs here at the LSE School of Public Policy. This webinar on putting women at the center in the COVID-19 policy response is part of a series that the IDA is organizing on the COVID-19 and early lessons from the pandemic. We are organizing this particular event together with the Women, Peace and Security Center and the School of Public Policy here at the LSE. But it's actually truly a global undertaking as we are working together with the institutions, partner institutions of the Women, Peace and Security, and they are on several continents. Their partners are the Georgetown Institute of Women, Peace and Security in Washington, D.C., the PRIO Center of Gender, Peace and Security in Oslo, Monash Gender, Peace and Security Center in Melbourne, and the WPS Institute at the Kofi Annan International Peacekeeping Training Center in Accra. I think I got that right. It's very appropriate that we have such a global group of co-organizers. Over the last couple of months, we have been living through a pandemic that has affected every corner of the world. The epicenter has moved from China to Europe and now to the United States. Over the next few weeks, it will move to the emerging and developing world. Most likely, it will take hold in Africa with massive increases in the percentage of people infected and death rates. Clearly, we need a global response to this crisis to give these countries a fighting chance to affect the toll of the virus and the economic impact that comes in its wake. By putting women at the center, we meant to look at this crisis from a women, peace and security perspective. We wanted to highlight how the pandemic in many ways is affecting women differently from men. We know for sure that the epidemics affect women differently, actually. And women seem to be somewhat less likely to die from the COVID-19, but they are in clear majority among the frontline workers in fighting the virus. And many industries where women are overrepresented belong to those most affected by the economic impact. There's also increased evidence that women pick up much of the additional burden from shutdowns when it comes to housework and childcare. I also saw some statistics suggesting that there has been a marked decrease in the share of scientific papers submitted by women since lockdowns started. So that's just one example of women taking the brunt of the adjustment. But the women peace security perspective is also about how things would be different if women were more included in decision-making and peace building. What has been the role of women in shaping the strategic response to the crisis? We probably shouldn't make too much of individual examples, but many have noted how many countries with women leaders have coped with the pandemic differently from countries where men are in charge. Is there something specific about women's approaches to a pandemic? Would the global response to the pandemic have looked different if women were in charge? We have a fantastic all-LSE panel to discuss the role of women in COVID-19 pandemic. Claire Wenham is an assistant professor in our Department of Health Policy and part of the Pan-LSE Global Health Initiative. Naila Kabir is professor of gender and development at the Gender Institute and at the Department of International Development. Sanam Naragi Andalini is the recently appointed director of the LSE Women, Peace and Security Center. I've watched how this center has developed and flourished since it was originally created 5 years ago on my second day here at the LSE. It's been an amazing achievement, and with Sanam here, I'm sure that you'll reach new heights. I will say a bit more about the panelists before I give them the floor later on. We have a record number of people on today's call, and I ask you to mute your phones when you're not speaking. And for those not on the panel, please keep your cameras off when you don't have the floor. This is to avoid background noise and to preserve the bandwidth. So we're going to start with some background on the pandemic and the experience of the impact of pandemics on women historically. So Claire Wenham works mostly in the crossover between global health and international relations. And she's been focusing on global health, security and global governance. She has worked extensively on global health crises like Ebola and Zika, and more generally on the governance structures of the global health landscape and the global disease control. So Claire, can you take the floor, please?
Sure. Good afternoon, everybody, and I'm delighted to be here amongst such an esteemed panel. So I'm going to talk to you today about what we can learn from previous outbreaks and previous diseases to inform our thinking around where women are in this current coronavirus outbreak. And so I think the first point I wanted to make is one of hope, which is that whilst we can say that women are going to be differentially and potentially disproportionately affected by this, the response that I've seen, such as events like this, such as the media coverage, people talking about women and the impact on women, the impact of outbreaks on women, I have not seen in previous outbreaks. Women were completely missing in discussions around Ebola, around Zika, and it was only a few leading academics who were talking about this. So I really welcome the fact that this is now part of the conversation, because I think it's such an important part of the conversation. The first part is thinking around, are women impacted? Are they infected rather than affected? And the way we can try and understand that is by trying to look at clear sex-aggregated data of cases and of incidents. Now, previous outbreaks hasn't always given us that, and hasn't always given us that in real time. So, for example, in the Ebola outbreak in West Africa, the data that was being shared by ministries of health to the WHO was just giving case numbers, and we weren't getting that real understanding of burden in between different age groups and different sexes. And it wasn't until during the outbreak that we got this sex-aggregated data, and suddenly it became clear that actually women were being disproportionately infected. And it was attributed to the role of caring of women, both formally as healthcare workers in the healthcare sector, and informally with women performing most of the burden of care to look after sick family members, sick children, sick elderly parents, whatever it might be. And so really the first question is, how can we learn from this and ensure that we're getting clear sex-aggregated data about this outbreak? Now, we know from the data we are getting that men are dying more, and we don't yet quite know whether that is for sex-based immunological reasons or due to social behavioral patterns, such as smoking. But we don't necessarily have a full complex data set to understand where women are being infected. And importantly, in places where we are getting this data, such as in Spain, we are seeing a peak of infection amongst healthcare worker women aged 18 to 45. And so that's why it's so important to notice. Now, whilst these women might not be dying, they are obviously being impacted in other ways, not being able to go to work, not being able to look after their children, the economic impact on their family in that way. My first plea is to try and push for clearer sex-aggregated data. The second thing we can learn about outbreaks and their impact on women is what happens when the health system gets distorted. So we know that when crisis happens in health systems, when health emergencies appear, all efforts, all resources go into fighting that crisis. Now that's understandable. We need to, quell the outbreak, minimize the spread. The problem is the knock-on effects across the health system, which have been shown to disproportionately affect women. So one of the ways this happens is through the impact on maternal healthcare services. So for example, during Ebola, we saw fewer women attending antenatal appointments, whether that was because they weren't offered in some places, and in other places it was because women feared going to hospitals because they saw that as the space where Ebola might be contracted. And this led to an increase in maternal mortality in these places. In Sierra Leone, we've got evidence from my colleague Laura Sochas in LSE that the maternal mortality rates increased by the same rate as cases of Ebola in Sierra Leone during the outbreak. So we really need to ask these questions about equity, and why do we care more about people dying of Ebola than people dying of maternal complications? This also affects access to contraception and access to abortion and sexual reproductive health services. This became really paramount during the Zika outbreak in Brazil, where women, given that the Zika outbreak was directly affecting women's reproductive health because it was affecting children in the womb, the fact that women were not able to access sexual reproductive health services, whether because simply they were in a location which didn't provide them, or because of restrictive abortion regulations in a lot of Latin America, this issue around can women access the care they need and the sexual reproductive care they need at times of crisis is also becoming important in this coronavirus outbreak. We are seeing abortion being weaponized and being used as a tool during this outbreak. If we think about how some states in the United States of America are using the coronavirus outbreak and the distortion of everything towards essential healthcare to limit provision of abortion. So we really need to rethink how the intersection between outbreaks and sexual reproductive health needs to be thought about. The last thing that I'm going to talk about, because I know I've only got a few minutes at the start here, is to think about the economic impact on women of outbreaks. So we know from examples of Ebola and of Zika that the economic impact on women is longer lasting than on men. So when quarantine happens, when any sort of public gatherings are stopped, in the Ebola outbreak, what this mainly affected was things like markets and market stalls. And most market stallholders were women. So a lot of women became unemployed, lost their economic security during the outbreak. Similarly, in Zika, women who were having children born with congenital Zika syndrome, because of the complex care needs of their children, weren't able to return to work. And what we can see in both these cases is that men return to work after the crisis sooner than women. And so I think it's now really important when we are having conversations around coronavirus, around women losing their jobs, both in the informal sector and being furloughed, such as in the UK, is how is this affecting men and women differently? What are the long-term implications going to be? And a lot of this is linked in with the fact that if women are performing caring functions, they may not be able to return to work until schools are open, for example. And so I think this is the time that governments and international organizations should start thinking about the longer term, because whilst the outbreak might be disproportionately killing men, it's almost certainly from previous experiences going to have longer term effects on women, on their economic and health security. I think that's probably my 5 to 7 minutes up. Eric, is that right?
Claire, thank you very much. It's perfect. So we will definitely have reasons to come back to what you were talking about and the need to, not the least, to just have the data to be able to make these statements about how it's affected differentially. So the next speaker is Naila Kabeer. She's worked extensively on gender, on poverty, social exclusion, labor markets, livelihoods, and social protection. Much of her research is focused on South and Southeast Asia, and that's a part of the developing world where we are now seeing very different strategies by countries being played out and be able to compare them. But Naila, the floor is yours.
Thank you. So I'm going to be talking about the economy and lives and livelihoods and gender inequality. And essentially, I want to use the fact that every crisis reveals something important about inequalities that we may not always have wanted to acknowledge. And this one is an exception. And every crisis has its own vocabulary. And I would like to draw on the way this crisis is classifying people in order to talk about how it reveals and conceals different kinds of inequality. The most prominent classification that we're seeing is, of course, between essential or key, essential and non-essential workers. And the most essential in this category, I think we all agree, because we are clapping for them every Thursday here in Britain, and they are banging utensils from them in India, are the health workers, the doctors and nurses who are at the front line in the battle against the virus. But here too, the crisis has revealed some very stark inequalities that exist even amongst the most essential of our workers. In the UK, women make up 89% of nurses and health visitors. They make up 45% of doctors, but there are twice as many men on the specialist register and more women as general practitioners. And they make up only 37% of those in the senior roles who make the decisions. In the National Health Service, which has been steadily starved of resources as a result of the austerity package that was imposed after the last crisis, nurses seem to be the least likely to be issued with protective and the equipment that they need. We've had a photograph in the newspaper of around 3 nurses dressed in bin liners as an indication of the kind of the very pathetic protection that they're getting, all 3 nurses were then diagnosed with the virus. Not surprisingly, large numbers of them are dying. But we don't actually know how many, or we didn't. In a very telling early statement, the Secretary of Health reported that 4 doctors and some nurses had died. Asked how many nurses, he said he didn't know. So we have a second distinction here, a second classification, the deaths that we count and the deaths that don't get counted. We now have a better idea of how many nurses in hospitals are dying, but we still don't know about the deaths in care homes, either the carers or those being cared for. What has also been very striking about deaths in medical staff, among medical staff, is the disproportionate numbers who come from the ethnic and Black minority groups. The first 4 doctors to die were all men, all Muslim, and all migrants. Subsequently, 6 doctors were also from ethnic minority groups. And of the health carers who have died in hospitals, the majority were from ethnic minority groups. Even allowing for the fact that ethnic minority groups make up a disproportionate percentage of the National Health Service compared to their numbers in the population, this is not coincidence. This is telling us something about the intersection of gender, ethnicity, and migrant status in shaping inequalities in the UK, determining who lives and who dies. But the Black and ethnic minority groups are also dying in larger numbers in the larger population, as I believe are African Americans in the US. We know that people with underlying health conditions are susceptible to the virus. We can safely assume that Black and ethnic minority groups are more likely to suffer from these underlying health conditions, but also from the factors that go with the underlying condition of poverty, which is overcrowded homes, shared bathrooms, very low incomes. Turning to the non-essential workers, we find a deep divide between the haves and the have-nots. The haves are those of us who have homes to log into, who have computers to continue working and doing webinars from, who have parks nearby that we go for walks in. In India, the haves were those who were clapping from their balconies, banging their utensils, turning off their lights and turning on lamps in order to fight the virus as instructed by their prime minister. And then there are the have-nots, the ones who live in these overcrowded homes we've talked about, in neighborhoods with no running water and overflowing garbage. There was a newspaper article recently about what we as a nation face in terms of a trade-off between creating health and preserving wealth. But for these people, their only wealth is their health. And so their trade-off is therefore between hunger and disease. Some of these non-essential have-not workers are linked to the global economy. We know, for instance, in Bangladesh, many thousands of garment workers have lost their jobs. First, because raw materials were no longer coming from China, and then because the buyers canceled orders, and then, of course, the employers laid them off. We know that those who have migrated across borders have found it hard to get back to their homes because of border restrictions. But the most visible, perhaps, have been those internal migrants in India who were given 4 hours notice of a lockdown by the Prime Minister, and then found themselves having to walk several hundred miles over several days to get back to their homes in villages, only to be turned away because people feared that they might be carrying the virus. And there are intersecting inequalities at play here as well, not just of class, but also gender, ethnicity, and race. We know that both men and women do these precarious jobs, but labor market research tells us that women are disproportionately represented in the most precarious of jobs. In the US, for instance, a Stone survey found that 21% of women reported a job loss in their home, compared to just 16%, indicating the greater vulnerability of women. And Black women were twice as likely as white women to report these kinds of setbacks. And in the Indian case, those internal migrants, most of them come from the very poorest caste and tribes, where the gender gap in wages is the largest. So you can say that tribal women and women from the lowest caste earn the very poorest wages in India, even though some of them may be heading their own households. There's another category of worker who we would regard as essential, but who is invisible and who is not even classified as a worker, who is not recognized as a worker. These are the women who take care of their families, cooking and cleaning, tending to their needs, looking after the sick and the elderly, a different kind of frontline worker, but one who is not paid and one who is not recognized. Their responsibilities, as Claire pointed out, their responsibilities will have been multiplied now that children are staying at home and that family earners are also staying at home. Now, it may be that these care responsibilities are shared by men in the family, But what we know from past research that even unemployed men don't do more housework. I'm not holding my breath, but I will be pleasantly surprised if I hear that men are taking on a greater share. What is surprising, but should not be, and is shocking, is what is being called the shadow pandemic. And that is the reported increase in violence in all the countries that have been going through lockdown. In Britain today, the newspapers carried a headline saying that women's refuges cannot take any more victims of violence because they are full up. They would have more refuges if they had not been cut back during times of austerity. It may be that the withdrawal of an exit option for women makes violent men more emboldened to be violent. It may be that men are more accustomed to having freedom of movement outside the home and find it more tasking to stay at home. Or it may be the precariousness of livelihoods and their frustrations as breadwinners who are not able to earn. They take it out on their the people who are powerless within their home. But whatever it is, reliable cash transfers might fix the final problem, but we really need to ask ourselves about this close equation between male identity and their breadwinning capacity. And finally, when this is all over, we need to take a good hard look at why the work of caring, whether it's paid or unpaid, is given so little value by the economic system that we have today. Why do we leave essential services that contribute to our health, our lives and our life chances to a market that values someone like Richard Branson, who owns his own island and several millions besides, who pays no tax in the UK and yet feels entitled to demand that the British taxpayer bail him out, while the nurses who are giving their lives on the front line earn less than what Priti Patel, our Home Secretary, calls a low-skilled wage? Why do we leave essential care services to a market, and I just looked this up for this, in which a blue diamond ring sold for $57.9 million? A ring for $57.9 million in 2016. This is a very weird kind of a market. Many of us believe that the care of people is too valuable to leave to market forces to set their value. The universal basic income is an essential first response, but in the long run, we need to nationalize and expand the care economy so that the value of care is set by society, not by the whim of market forces, and so that we can then universalize access to basic services. But of course, for that to happen, people like Richard Branson and his ilk are going to have to pay their fair share of taxes. Thank you.
Thank you very much, Naida. A lot of food for thought there. Sana Nadag-Anderlini, she, as I presented her before, is the director of our Center for Women, Peace and Security. She's been a long advocate in the field of women, peace and security. She has worked on conflicts and crises, violent extremism. She's also the founder and CEO of the International Society Action Network, better known as ICANN, where she spearheads the Women's Alliance for Security Leadership and combining a number of women-led organizations around the world in preventing violence and promoting peace, rights, and pluralism. Sanam, please.
Thank you very much. I hope you can hear me. It's great to be here with you all. Thank you very much. And it's really great to have a multidisciplinary conversation, because so often we have the lone voice around talking about women and we have to sort of pile everything into one 7-minute session. So it's really nice to actually hear everybody else and then be able to add the perspective that I come from. I've been working for the last 25 years on countries and communities affected by conflict and violence and crisis of varying sorts. So in a way, there's a lot of similarity between how this pandemic is affecting people. So when we say gender-based violence or domestic violence has gone up, unfortunately in our community, it's nothing new, sadly. And I keep saying to people that domestic violence isn't an airborne disease. It is somebody deciding to raise their hand and be violent against somebody else. And this is something that should be stoppable. And yet we talk about it in the passive tense. But sadly, it is something that happens in crisis. And we can talk about that in more detail later on. What I wanted to share with you today is, in a way, 3 questions that to sort of talk about why and how it is that not only we have women as frontline workers, but what is it that we're saying, and specifically as scholars, practitioners, advocates, with a feminist and a peace lens, how does this pandemic actually relate to much of the discourse that we've had over the last 25 years? but to begin with, the first question I wanted to address is, what are women doing? I'm dealing with, as Eric mentioned, a network of women-led organizations in 40 countries, all of them affected by violence or conflict in some sort of way. And literally in the last month and a half, I've been on daily communication with partners around the world to try and understand what they're doing. And what's fascinating for me is that these very local organizations, whether they're in Somalia, Kenya, Colombia, Indonesia, Yemen, places that right now we rarely hear about on the news, certainly in the United States and internationally, but in these places, women who were doing peace building work before have been the first responders in terms of addressing people's needs. In Iraq, one of our partners in Basra was the first person to actually lead her team with masks and gloves and sanitation kits and so forth to go and raise awareness. In Pakistan, they've been making hand sanitizers and sharing the information. They actually have a network now of rooftop communication of the guidance that's coming out. And in Syria, in Yemen, in amongst refugee communities, what we're seeing is that these organizations that are relatively small, but have been doing peace building work, which basically means they have access to communities, they have trust, people come to them and they can reach out to them, are the ones that are sharing the information. And as they share the information about how, the hand sanitation and washing hands, all the things that we all hear about, they're then hearing about, well, there's no food. And so they end up producing food bags and bringing the wealthy community members and others and trying to figure out how do we feed people. And then from the feeding people, it's about the gender-based violence. So they're actually intervening and dealing with, at a very local level, how do we stop the violence in the home and how do we provide shelters and then providing shelters. So there's a kind of a continuum of ongoing first response that we're seeing community-led organizations doing, specifically the women's organizations. And they are also the first ones that have been, as usual, raising the alarm bells about rising extremism, militant extremism groups that are exploiting this agenda right now for their own purposes. So for example, in Somalia, our partners are telling us that all the public health messages that are coming from the state are just not being believed in. People don't trust the state. And they're listening to the extremist imams who are telling them the Muslims don't get corona. So they don't do the social, they're not doing the hand washing, they're not doing the social distancing, and the levels of death are actually going up. But somehow people still believe those messages. So it's essentially through the lens of women, what we see is all these things that you heard from my colleagues, but magnified in the context of crises. And what they show to us is that we have had 40 years of essentially neoliberal structural adjustment economic policies that have shrunk the presence of social welfare of the state. And in the last 20 years, increased the militarized presence of the state in the sort of world of counterterrorism. You put that on the ground, and the implication of it is that for the most vulnerable, marginalized communities, men or women, there is no healthcare. There hasn't been any education coming from the state. The police is predatory, right? People just don't trust the state. Therefore, when you end up with a pandemic like this, the messaging that comes from the state is not believed in. And meanwhile, the vacuum that the state has left has been filled by these other groups, whether they're religious militants, whether they're gangs, whether it's all these other elements that are community-led are now responding to people's needs. And when they respond, they build loyalty. So we have to think about the implication of this in the long term as we come out of this, that who are people going to be listening to? And that's very, very significant. So you have this problem. Now, the other side of the story, the reason why we have these women's organizations being able to be agile and responsive, and as Claire mentioned, elevating this gender dimension so fast in the context of this crisis, is that for 20 years, we've also been building movements. The network that I work with, they're very locally rooted, but we're able to connect them globally. So the minute this problem started, we were already active in saying, what are the issues? How do we bring it to the policy level? And really trying to push the boundaries of making sure that the gender dimensions and the gender analysis is front and center of everything that's being done, and the voices of the local actors is being heard. It's still difficult, but it's something that I think is one of the positive aspects of what is happening. The third question that I wanted to raise is, okay, so we have what women are doing on the ground, and in a sense, essentially why this is all, why they're having to respond because of the absence of the state. But what have we been saying? And here I wanted to just point to two questions. As a feminist researcher, scholar, practitioner, advocate, with a security lens, one of the things that has drawn me to this field of practice all these years is that we question the definition of security. National security that we all are used to and think about is very much militarized. You know, the enemy is somebody outside coming. Therefore, we have been used to the idea that we should be stockpiling machine guns and weapons and so forth. And that's actually been to the interest of the defense industry. In the United States, we have a $800 billion budget for the Pentagon. 2 weeks ago, they tested a $100 million drone, a hypersonic drone that can carry a nuclear warhead, in the middle of the state of greatest national insecurity, when 22 million people are unemployed and the frontline workers, which are the health workers, don't have masks. So we have stockpiles of weapons, but not enough stockpiles of masks and PPE. This is a security issue. And as feminists, we have always been saying we have to redefine security. What does security mean for me? And then how does it elevate to the national level? And what it's showing is that national security, or any kind of human security, is not coming through the budgets and the way that we're dealing with the status quo. It really needs to shift. I think that's going to be a big debate, and I think that the folks that are on the defense industry side are not going to be happy at all with what we're saying, and they're already putting up their defenses to push back, but it's something that we have to do. Similarly with the economy, and it's the same question, that if we've had all this talk about economic growth, and yet we're at a point where billionaires, including people like Jeff Bezos, are asking us to give him and his people money to pay for his workers when he's sitting on God knows how many billions of dollars, you have to ask the question, what has the economic growth model done? Who is it for? Why are we participating in this if it's actually not providing us with the economic security that we need, or fulfilling the social and economic rights that supposedly all of our countries have signed up for, which is the work of Radhika Balakrishnan and others, where they intersect human rights and economic policy together. So I think that in terms of where women are situated, as I say, they're not only at the front lines of response to the crisis in the immediate sense, but they've been at the forefront of the discourse around what the structural problems are and how we respond to them. And I think that this is a real opportunity for us to continue those conversations and shape what we come out with ultimately. Thank you.
Thank you very much, Sanam, and thank you to everybody for being so disciplined in terms of time. So we have an absolutely incredible, I think, audience today, and you have been presenting yourself a bit on the chat room, and it's truly a privilege to have such a wide range of people and backgrounds represented. So we're going to try to bring you in. There are several ways. One is through using the raise hand function in Zoom. You can also pose questions in the chat room. For those of you who are on Facebook, we will try to feed in questions that you put on the comment section of your Facebook. So maybe I can pick up one more like a comment, but I think it's a very important comment. It's Dr. Yabode Ugunirayan. Are you on the call? Can you come in? If not, maybe I'll take the questions, and because it is a very fundamental question, particularly in developing and emerging economies. It's about how should we view the virus versus the effects on the economy, and particularly as you write, the coronavirus kills, but hunger virus kills faster. So how do you see that, again, from the perspective of women? How do we make these trade-offs, and how can we make progress on both fighting the sort of medical emergency and the economic emergency? Maybe that could be a first question to the panelists. Maybe, Claire, do you want to start?
Sure. So I guess what's been really interesting in the global health security space has been that people don't think about other types of crisis, right? The crisis is the emergency, the crisis is the virus, the outbreak. And we've seen this over successive outbreaks, and this ties into some of what Sanam was just saying around that, you know, the everyday crisis is completely missing, whether people can eat, whether people have got other competing priorities. Certainly in the Zika outbreak, which I've been studying for the last few years, you know, the everyday crisis of living in low-income settings in Brazil, right? Zika, mosquito control is the last of the things women are worrying about, right? They're worrying about, are they going to be fed today? They're worrying about the increasing violence on the streets. They're worrying about, you know, where are their kids? Are they going to school? They're not worrying about mosquitoes. And so those other things that are part of human security have been completely missing from health security planning. And I think what we're seeing in this outbreak is that policymakers, you know, sitting in Geneva and Washington don't necessarily understand what's going on the ground. And so they can make this policy saying wash your hands, socially distance, but without recognizing what reality is like for most of the world, it's, you know, almost impossible. And can I just jump in and just respond to one thing that Saman was saying around kind of the role of women within the state and within this security practice? Is just to kind of tease out that actually I think not only are women not part of that discussion, and there's a disjuncture between the kind of military security landscape that we're seeing and the human security landscape, is I think they've almost been instrumentalized by the state, right? You know, women are performing this amazing function as frontline healthcare workers. Women are performing this amazing work, you know, in their everyday lives. And that ability to instrumentalize them also manages the government to absolve their own responsibilities, right? Because they're saying, look, this is happening in our country, isn't this amazing? Rather than actually getting to the root cause of the human insecurity that these women are having to then counteract.
Can I just to echo what Clara was saying? I mean, for the last month, I mean, ever since the crisis started, and I've been talking to my partners, you know, I've been looking at the WHO and the UNHCR sites and others to say, what do you do in places where there is neither soap nor water? What's the point of telling people wash your hands with soap and water when you're actually when it's not available, right? And the fact that it's not available is itself an indication of the failure of development policies, et cetera, over the last 40 years. It's insane that we live in a world where literally people, whether it's in Cameroon or in Yemen or in Somalia or wherever else, they don't have access to clean water or they can't afford soap. So that's one side of it. And we've now reached a point where the women that I'm working with, we're having conversations about how do you make soap from natural products that you have around you? What are the natural disinfectants that are there that you can use? Because it's not available. Nobody's providing it, right? So they're having to respond and fill these vacuums. And the international community is largely absent from these, not only absent from the conversation, they're absent physically. Literally, they're not on the ground, right? So to me, one of the biggest issues that we need to be thinking about, whether it's in the fragile context and places that I focus on, or in the Western world, is that we need to revert back to having community infrastructure to be able to be agile enough to deal with whatever crises. When we had Hurricane Katrina here, it was the same thing. The state was absent. You need local people to be able to have the local systems in place to be able, because they're responding anyway. So how do we put the resources into enabling that to happen? I think these are some of the things. On the question of the economics and the humanitarian side, I'm talking to my partners right now, and not only we with my ICANN hat, we're actually trying to make sure that they are getting resources in time. So small, you know, grants of $10,000, $20,000 into those hands goes a long way. Meanwhile, we have the UN that's asking for, you know, $100 million, $300 million. I get it, they need that money, but in the immediate term, these small grants save lives, but we need to have the channels and we have to have the local social capital there. So sustaining that social capital, sustaining the community structures and so forth, independent civil society is a really key pillar of the good governance, security, peace building, crisis response that we need. That needs to be front and center of any development, shifts in development policy that we have. And it's actually not about new money, it's about channeling money in a much more effective way to places and to people who care. And my right now, for me, the indicators, if you can find people who care enough, they will get stuff done. But if people are there just because this is a new opportunity for them to raise money or have a profile or whatever it is, then steer clear of them. But it's literally about individuals who care and how we build and enable them to have stronger platforms to be able to do the work.
Naila, I said in passing that there have been some sort of wide range of policies pursued in South Asia and Southeast Asia. Could you say something about that, you know, and how this is playing out in terms of lockdowns and effect on, you mentioned, you know, very telling examples of migrant workers and how they were affected, but could you say something about, you know, what are the early lessons? And there's a question here from Sala Turunen. She asks, you know, how does COVID-19 influence gender responsive intervention in humanitarian emergencies? Can you see some patterns there from the South Asia experience? I'm
going to go back to the earlier question first, because it links to something that I was trying to say, that for some people, the trade-off is between, you know, living between food and disease. And I think one of the issues that's being raised, and it's quite a complicated issue, is should the global south and should poorer countries in the global south be immediately imitating what is happening in the more affluent north? In other words, the idea of a lockdown for people who have no food, no running water, none of those things is quite problematic, you know, and the trade-off is very, very harsh. One of the things I think that in Bangladesh that they're doing is trying to distribute food. Because money is important, but right now, the most important thing is food. In terms of the other gender responsive lessons, you know, I don't think that what we've had much more of is community-based social protection. Governments have been quite slow to respond. Governments have been quite slow to do the testing and all the other things that would allow people to resume normal livelihoods. So I don't think there are any, you know, brilliant lessons. I mean, I've been talking to BRAC in Bangladesh, and they have been carrying out, you know, rapid appraisals to find out what it is that people need. And they're trying to make those distributions. But I'm also hearing about a conflict between big pharmaceutical companies and smaller NGOs about what kind of face mask and testing one should use. So the battle between, you know, private market forces and NGOs seems to be continuing. We can think very well about gender responsive programs. And one is, of course, around taking community responsibility around care. You know, neighborhood organizations to help women deal with the care burden. We can think in terms of what we can do for the frontline health workers in the field. A lot of what is being done in the UK in hospitals is being done within the community in, say, India. You know, to what extent can we provide them with the protective equipment that they need? So I'm not sure as yet that I'm seeing any glowing examples of people getting it right, except at the level of communities.
And can I just follow up on that, if that's okay? I think one of the big gaps we're seeing from a global health policy perspective when you're thinking about a gender responsive approach to this crisis is that that's not formally in any structural or regulatory framework. So, for example, we know that in climate change policy and climate change discussions, there's a role for gender advisors. We know that in humanitarian response, there's a role for gender advisors. Within global health emergency response, which is governed by the international health regulations, by the World Health Organization, there is no mandate for a gender advisor, right? And this piece of international law is the framework that national governments then implement their pandemic response around, right? So the structural impediments to having a gender advisor are the fact that it's not listed, right? And gender's not part of the conversation like it is in other health emergencies. And this sort of perpetuates this siloism between like a public health response and a kind of humanitarian crisis. And it kind of leads to this fudged understanding of what we're dealing with here. And actually, I think it's really time that certainly we need to rethink, you know, why haven't women got a seat at the table in these frameworks for responding to outbreaks of disease?
Can I add one more thing? And that is, the same thing that's happened in Britain in terms of austerity measures, dismantling the welfare state, dismantling refuges for victims of violence. I think we've seen the same thing happening in the Global South. So to try and respond to a crisis after the event is far more costly and difficult than to try and respond to a crisis from some kind of ongoing social protection. One of the reasons why Kerala has done so well in responding is it has a network of government public health workers who have been able to be mobilized to do the work. Those kinds of measures, those kinds of social protection measures were being run down everywhere else. So I think one of the lessons is you don't prepare for crisis after a crisis. You prepare for it before, and then you scale it up in the face of crisis. Because everyday crisis is going on all the time. And so I really believe one of the lessons that has come out of this is that we need to have in place institutionalized responses, which are there for everyday crisis and which can then be scaled up to meet.
I would just to add a couple of things on this. Again, working in when dealing with crisis context, when the state isn't there or the state structures are either exploited or become predatory, or you need that. Good governance, in a sense, for me, it's not just. It's definitely you need the kinds of structures that Nyla's talking about, but you really need to have it matched with a recognition of an independent civil society, non-governmental sector that is also there, because the two of them need to work hand in hand. And actually, in Indonesia right now, it's one of the few places that we're hearing where the government is actively reaching out and engaging civil society and figuring out the division of labor based on comparative advantages, in a sense. It's like, how do we do this? Who can do what, where, but having a coordinated effort, but recognizing that the sector itself is of value, as opposed to being a sector that either you exploit and you instrumentalize, or it's a sector that you're trying to crush in the midst of a crisis. So that's one thing. The issue that I find interesting is when you talk to women who are active in these spaces, and I want to, it's not all women, because we have some Dr. Brickses in the mix as well, right? So let's let there, but it's specific kind of when you bring this lens of inclusion and so forth, it's that we seem to sort of avoid the tyranny of or. Right, so it's not just this or that. It's how about doing this and that. I have a colleague in Liberia, and we were talking about the humanitarian work that she's doing in the care packages. And I said, what are the kinds of things you're putting in? And people are talking food and sanitation. And she said, well, we're including sanitary pads. Right, it just makes perfect sense that you're putting packages for families together. Why not add all these other basic things? It's and you bring it up to the global level, and it's called integrated and coordinated and multi. It's simple on the ground. It's relatively simple in terms of what needs to be done. You just have to have common sense and think about it in terms of putting yourself in the shoes of the people who need, and figuring out what's the most dignified way of engaging people. And it's Nyla's point about the global South and the rest of the world. The global South is here in Southeast DC. There is global Souths in every community, in every country that we're dealing with, places where people cannot afford to not go to work. And that has to be acknowledged, that the levels of disparity in India and in the United States, frankly, the rich in India have more in common with the rich in the US than they have with the poor in India. So it's really kind of, we've known all this stuff. It's just that now we need to address it in a more systematic way. And one last thing is mental health. Mental health has been the poor cousin of healthcare in crisis settings globally, and yet it is one of the most important issues to be dealing with. And again, what I'm trying to do and through the networks is online trying to figure out how do we give people first, almost like emergency capacity to deal with a first aid mental health, but it's an infrastructure again that really needs to be integrated into global health responses. Thank you.
Thank you very much. Could I have Graciela Pigak, are you there?
Yes, I'm here.
Can you ask your question?
Actually, I asked 2 questions.
Okay.
So the first one. So I was actually, especially for those that are in the UK, I think all the 3 panelists are in the UK. So, we've seen how, all the narrative about low-skilled workers, especially just before the pandemic started. and how these skilled workers have become key workers during the crisis. So what do you think? Do you think that this will bring some long-term changes on the way low-skilled jobs often taken by women will be considered when the crisis will be over? This is a question for all panelists.
Yeah, so will we get any lasting changes from all this clapping for healthcare workers and extra tips to deliveries and so on? Will this last beyond the crisis?
You know, it's up to us. Mm-hmm. It's up to all of us. And I think it's up not just in Britain. I think this is a global challenge, that the measures that come after this crisis, and somebody has written, you know, is it going to be like austerity all over again? You know, is it going to be the low-skilled and the public sector workers that are going to bear the brunt of the money that has supposedly to be paid back? And I think this is where the whole issue around taxation and so on has to become a part of the story, you know, the tax for justice and so on. Because I really think that markets cannot be trusted to recognize valuable skills. And when you leave it to workers who have very little bargaining power in the market, and it's only at times like this suddenly we start to clap them, you know, I don't think we can go back to that. And, you know, the only way we can make sure that we don't go back to that is through a global movement.
Yeah, I worry, my concern is that I worry that it's going to get worse, because, so especially in the sectors and the areas that I work in, you know, the way that security and development policies are thought, there's a big pot of money for security and military and so forth. And then there's a little pot that goes towards development aid and humanitarian aid. They go together. When you have crises, the humanitarian aid, the immediate humanitarian needs trump the development assistance. So basically what we're seeing, that's already beginning to happen. I think 2021 is going to be very, very difficult for the development and the peace building sector. And what we need to do is to say, do we really need that $100 million drone? Because $100 million put into the development aid sector goes a long way, where it's literally a drop in the ocean in the security. So there, again, it's really shifting things, but we have to have a willingness and a voice to be able to talk about shifting budgets. And you know, we often hear, oh, crisis is the same as, you know, the flip side of crisis is opportunity. I see it as the flip side of crisis is opportunists get ahead while the rest of us are trying to deal with the immediate crisis. So we actually need to be challenging these things in Parliament and in places where legislation and budgets are being assessed and discussed, given that there are going to be cuts, but to make sure that the cuts are not just in one side of the story, that those other sectors also are really examined.
I collect a few questions from the audience. And Mwila Shigaga, are you there?
Yes, I am. My name is Mwila Shigaga. I'm the ILO Regional Gender Specialist responsible for Africa. You know, I had a question for both, let me just say all the panelists, the resource persons, and thank you very much for your excellent presentations, by the way. You know, what is really, what is really sort of touching me is what can we do differently? I mean, it's clear that we need to strengthen the agency of women. We need to get women at the table. But I mean, my question is, what can we do differently? We've been doing this for a while, but is there something that we can do differently? Thank you.
Yeah. So there are several questions along those lines. You know, it's a common theme in the questions that, you know, what are the examples of women actually changing the way we implement these policies? And what have we learned anything? Maybe Claire, you can comment on this also. What have we learned anything from the previous episodes of epidemics or pandemics about how to include women more effectively in the management of the crisis?
So I think you've got to take it back a step first, and I think you've got to think, is it recognized as an issue, right? And recognition is the first step, right? Are people, our governments, whoever making decisions and deciding on response to this, do they recognize that there is a differential, disproportionate effect on women or not? And then when you've got that mindset, then you can think about how to mitigate it. My concern at the moment is that there's a lot of conversations happening in the advocacy space, in the media, by academics, and I'm wondering if that's happening by policymakers, right? Are people sitting in governments having these conversations? Are they thinking about it, right? In the UK, are they thinking about the impact of school closures and furloughs on single parents, right, who are disproportionately mothers, right? Are they thinking around furlough, which you can't do in furlough is not applicable to part-time workers, the majority of which are women? Are they thinking about all these differential ways that policy can affect them? And this obviously is going to look different in every single context. And I don't think there should be a hard and fast rule, other than, why aren't we having that gendered analysis, gender advisor at the discussion table like we would be in other spaces? I think the other thing, and kind of linking back to your last question, is around recognizing the value of care and recognizing the value of care across different sectors, and that doesn't have to be performed by women, but majority of whom is performed by women. And I don't think after this crisis, I don't think civil society and carers and the global community is going to let governments go back to a place of not caring about carers, which sounds crass, but I think you can't on one hand be the politician clapping carers and on the other hand be the politician who's paying them the minimum wage, right? That's hypocritical. So I think we've really got to push the government, certainly in the UK, on that and say, well, why are you paying them £8.20 an hour? And that's not enough for the value they give to society.
Can I? You said it very early on in your first intervention about data, and there's a question from Facebook here from Alaima Jawad. She asks, how can we measure, identify to what extent the state's response to coronavirus is gendered? And you touched on it also in your intervention now. But so, how do we get data? How do we identify these distortions?
Well, so for example, the World Health Organization collects data to compile a dashboard of current cases and incidents of this outbreak. And, we know that every time we go to a health clinic or hospital, that data is collected, right? You're asked your age, you're asked your gender, that is definitely being collected. It's just not necessarily being reported, right? We know that we have, so certainly the conversations I've been having with the World Health Organization are that they've got some data, but it's not comprehensive because the tyranny of the urgent takes over, and it's more important to governments, to ministries of health, whoever it might be doing it, to report total data, total numbers, rather than break it down into these age categories, sex categories, whatever it might be. And so I think it's about making sure that that happens as commonplace, right? We know that in these SDGs, there was a requirement to report sex-segregated data. Well, why is that not happening? Just because it's a crisis and it's not, it's deemed to be more important than report anything than report well, but not counting is to exclude. So I think we really need to push governments to ensure that they are reporting this.
Can I just add on the whole question of sort of the infrastructure and how we've been doing and so forth that our colleague from ILO came up with? When I put my practical optimistic hat on and collaborative hat on, I say, well, yes, 20 years ago, we were never talking about women in any kind of crisis. And now it's, whether it's a war or whether it's a pandemic, we're talking about it. But the truth of it is that when we look at the structures that we put in place, whether it's gender advisors or others, these are small incremental steps. And it's constantly as if the gender advisor, who is typically a woman and very often junior in position, or even if they're given a senior post, they're kind of marginalized into the corner office, basically away from actually the decision making that's happening. It's basically putting all of this on them, as opposed to saying, you know what, you are the health expert. How can you possibly not have a gendered lens in terms of understanding health dynamics? Men and women have different health issues or response. We have to put the human being at the center of all of these things and start from there. Not saying I'm an expert in health crisis, Ebola, but actually I have no idea, and I don't think it's my issue to understand whether it affects men and women, age, children, etc., differently. It seems absurd. So the notion of gender as a skill set has to be integrated across the board, and we have to look in. So that's one thing. The second thing is that if we want to do things differently, we need to look at where we failed. I've been on calls recently where honestly, it drives me insane that we're still talking about conflict prevention and early warning and peace building as if we're 25 years ago. It's literally the same conversation I was having 25 years ago, where at the time it was fresh, people are having again now. And the contexts have changed. There's a lot that's similar, but there's a lot and the reason why we're having the conversations is because the stuff that we recommended 25 years ago hasn't been done. So if we keep just talking and it doesn't get done and nobody's held accountable and people move jobs because that's the nature of bureaucracies and so forth, then we're constantly back at reinventing the wheel and doing it worse than we did the last time around. That's what I get frustrated with, right? So it is about policy, but it's about accountability of the technical folks, of making sure there's expertise on these issues and sustaining it, and not allowing the AAA syndrome of ad hocery, amnesia, and apathy, which I've seen in the years that I've been engaged in these spaces.
I think there is one other challenge, and that is about the arena of politics. I really would like, I find it really depressing to look at what's happening in the United States, that after all the very able women that were running for the Democratic ticket, that we end up with, two quite elderly gentlemen going to be competing next time round. I feel a bit more optimistic about Britain, but really I think feminists do need to get together to promote a much huger presence in politics, as inhospitable as the arena of politics is. Because that arena is not going to get any more hospitable without many more women participating in it. And without having those women in politics, a lot of the decisions that get made from a very specific and very narrow perspective. So along with having women in the policy-making process and the bureaucracy and so on, I really would like us to think very carefully about how do we promote, enable women to win in the political game.
A lot of questions including from Facebook on this. We have alluded to the role of women in some particular countries that seem to have done very well in fighting the virus. Is there something that we can extract from that experience that's common across, or can you say something about what is the characteristics of what Jacinda is doing, or what Angela Merkel has been doing in Germany, or what is there some pattern that you can extract from this, or is it more a coincidence?
I don't think it's a coincidence. I think we see a number of things. I think number one, we see, and I'm just not necessarily in order, but I see the ability to automatically see the human face of this. So the fact that the Norwegian Prime Minister was the first one to hold a press conference for children, to basically to empathize and to show compassion and care and show the human dimension. The fact that basically they're able to anticipate and plan in advance and be very, very practical. It's not politics. It's really about being practical, having the competence. Angela Merkel, of course, has the chemical, she's a chemical engineer with a background and so forth. I think part of this is that when we say that for women to make it into these leadership positions, they have to be 3 times more proficient than the men that they're competing with. This is where we see it. The problem for me is not, the fact that we see women doing really well is great. But what I'm more worried about is how on earth did we end up with a Boris Johnson or a Donald Trump or a Bolsonaro? How is it that we have a political system that allows a man who has profound track record of incompetence to become a prime minister, and in the midst of this crisis has huge family issues? I mean, this is what the Sunday Times article highlighted about Boris Johnson. The girlfriend, the wife, the kid. I mean, if it was a woman, can you imagine a woman who was going through a divorce and had a lover and was pregnant and had 5 children being made prime minister and then being given a free pass in the middle of a crisis? It just wouldn't happen. Same with Donald Trump. We've had more deaths, American deaths in this country than the Vietnam War. And he still has over 40% popularity. The people around them are enablers, and they also have to be held accountable. So the women, you know, it's like we have women's leadership, which is fantastic. They've had to really be so much better than what we expect of men. And at the same time, we're enabling and allowing male leaders who can just be, I don't know, charming or funny or whatever to get in, and the media enables it.
I think there's one other thing that really strikes me. Whether it's a coincidence or not a coincidence that so many of the most able leaders in this crisis are women, one of the things that strikes me about the men, some of the men that are leading on this, is their reluctance, you know, their sense of masculinity seems to be tied up with a dismissal of the danger. You know, with Bolsonaro, with Trump, with Boris, you know, Boris boasting that he shook hands with everybody, then came down with the virus. It's the makeup of certain kinds of men that sees, you know, admission of danger as a form of weakness. Mm-hmm. And that's where I think Justin Trudeau seems to be a slightly different story. And that's why I think the women have no problems about this kind of an ego. You know, they can say, look, we're in trouble. Here are some practical ways of dealing with it. And let's do it early.
There was a question from Sarah Kaplan. Are you on?
Yes, I am. Thank you so much. My question was just, you know, I love this conversation about how we need to have systems in place that, you know, precede crises so that we're not ad hoc addressing the crises. And so one of my question was, when we think about economic measures like the GDP, which for many years feminist economists and others have been talking about how that excludes all sorts of contributions to society that then lead to these distorted systems we have. Do you think that this is a moment when we could push for better measures of economic prosperity that would include things like unpaid care work? Is this a moment when we could take advantage of that multi-decade long conversation, but actually push for it at the governmental level?
Can I take in another question also? I think we definitely should follow up this question. Monica Jasis, are you there?
Yes, I am.
Yeah.
Hi. Okay, I have the question that I have is about how do we connect? I mean, I am from a community health organization, very grassroots, and also impacting upper levels. So there is apparently there is a no connection between the government doesn't know how to get to marginalized women, how to get the message about domestic violence and how they can get to the services. And we are the connection, but there is no dialogue between community health organizations and the governments, and that's all over Mexico. So I think, and that's all over Latin America, how to get to the most marginalized women that are being plagued with this violence against women pandemic. Exactly. So are there any lessons learned that are happening in the world, in other parts of the world that can we share?
I think this question, there is some very early work on looking at the impact of the COVID crisis, and what you say seems to be very well borne out by that data. Even those cash transfer programs and so on that the World Bank has have not been very effective and not really protected people. So we need to think in new terms. I let the panelists come in to that. Maya Hilmi, do you want to come in?
Hi, thank you so much for all of your amazing comments. It's been really useful. I just wanted to ask what is being done to reach, vulnerable women and children, and of course, families in refugee camps. So whether in the Middle East or, around the world, they're already quite hard to reach. They already face gender-based violence, and women are often the caretakers. There is like a switch in the, conventional gender roles, and the patriarchal society norms are changed. So I was just wondering, what is being done to, reach these women? Thank.
Okay, thank you. So we had the first question on sort of having systems in place before a pandemic erupts and maybe thinking more deeply about how we measure things. There was a question on these civil society organizations' role, and now finally on refugee camps and so on. Who wants to go?
Can I respond to something else?
Yeah, okay.
I just was reading the chat show.
Yeah.
And somebody called David said, you know, for women to win, you suggest that men must lose. No, I don't.
No.
For women to win, we need men to support them. But I do mean we want women to win. We don't have enough women in politics. And I'm sorry if you think my tone turns them off. But I genuinely mean we need women to win, be there in the political space, making decisions. And for that, we need men's help. And I wish men would stop being so sensitive.
Yes, I just want to echo that the number of times I've heard in various contexts that, you know, when you say gender equality, it means women getting ahead. And I say equality does not mean getting ahead. It's actually better for everybody. And this is one of the issues around, you know, a lot of the discourse, because so much of the traditional, at least in the States, more and the older generation of women that I come across in the political space, they see it as women getting into the spaces and having the same status quo spaces as men. For me, what we're looking at is transformational equality, which is basically saying, you know, if women want to go and become combat soldiers, that's an equal opportunity issue. What I'm working on is that neither men nor women have to face war. I don't want my son or my daughter to be thinking about having the prospect of war. So it's that transformational equality of thinking about it in bringing women's perspective, but thinking about it as a better world for everybody. And somehow, for some reason, either, you know, we get very few guys who actually engage in these conversations and understand it. That they literally, I'd love a sex disaggregated data point about participation in this seminar, just on that point. On the questions that were raised, I'll take a few of them together. So definitely in the case of refugee camps and internally displaced people, again, the people that I see dealing with those communities as first responders are local community organizations. Like our colleague from Mexico said, when it comes to marginalized communities, when it comes to women, whether they're within their own context or IDPs or refugees, it is civil society, it is local civil society organizations, peace building organizations that have become the first responders because they already know those people. So if you're already working with marginalized women or victims of violence, or in Mombasa, one of our colleagues is working with disabled communities. If you're already working with them, automatically, when a crisis erupts, you're thinking, well, what happens to them? So we need that infrastructure in place because governments either don't care, or they're overwhelmed, or they don't reach, and just don't have, or they're not trusted. So these two sectors are absolutely critical. On the question of the economic policies, again, my colleague and friend Radhika Balakrishnan has been saying, why don't we think about it in terms of looking at our economic and social rights, the conventions on economic and social rights, and measuring government success or performance based on delivery of those rights. We already are meant to have healthcare and access to food and water and shelter and so forth. Well, why isn't our economic and fiscal policy measured against whether people in the most marginalized areas are getting that access and how people are doing? So shifting and putting the accountability there, as opposed to saying we've had 3% growth and most people are basically experiencing, you know, unemployment or lower wages or whatever. So we need the economists to actually engage with the feminist economists.
Natalie Hudson.
Hi, thank you so much. I appreciate all your insights this morning here in the United States. My question was about language, and all of the panelists have spoke to the impact of language in one way or another. And as an activist, as a researcher on women, peace, and security, how do we engage in relatable and relevant ways with policymakers and decision makers, and in an effort to center women's experiences and to raise questions about security and insecurity from a feminist lens, while also not reinforcing ideas and the centering of the military, right? So going to battle, the frontline workers, all of this language that continues to prioritize a very militarized approach to security. And so I'm wondering how our panelists think about language in those terms. So thank you.
There's a question from Sarah Casteran on Facebook to really commenting on what you were saying, Suna, about the militarization of security and how do you think we can redefine security today?
Can I jump in? Can I jump in on that? Yeah. So, having studied health security for many years now, this was a strategic decision by public health people to use this language, right? Back from the time of HIV, and then it really solidified after 9/11, and immediately after 9/11 we had SARS, right? And it was the public health community recognized that their budgets were not as big as the Department of Defense, right? And it was a strategic, let's use this language, right? Let's call it a security issue, so we can start to build pandemic preparedness, biosecurity weapons, biosecurity tools from defense budgets. And so it's sort of a victim of its own push, right? The public health sector wanted this to be able to get money. The problem with that is that it's a certain type of security, which is state-centric. It's about state protection from the threat, right? And not about protecting individuals or individual women or even communities. You could argue it's not even about protecting the population. It's about protecting economic security, right? And ensuring that trade and travel routes aren't disrupted. And that was the kind of basis of the whole health security movement, which has grown over the last 2 decades. So, I completely agree that this language is problematic, but public health has brought it upon itself.
Can I just add to that? Again, we have sort of, back in the 90s, we had a period where we were talking about human security and the idea of what is security. Security is not just militarized. It is about health. It is about non-conventional threats. It is about climate change and so forth. And that's actually when the Women, Peace and Security Agenda, that's one of the avenues through which we got the Women, Peace and Security Agenda. We got that in October of 2000. September 2001 was 9/11. And we entered the world of the counterterrorism, hyper-militarization. And that's the air we've been breathing for the last 20 years. And so what I see is that we were trying, and we continue to try and say, we need to humanize security, right? We need to think about security. What does it mean? Economic, social, education. We need to humanize security. And in fact, what's happened is that we have securitized humanity. This is, in the last 20 years, that's the shift and so it's very dangerous to say, oh yes, let's get the military out onto the streets. I don't want the military out on the streets. The military is quarantined right now. They're actually showing how useless they are for something like this. But they have big pockets, they have big lobbyists, and they will try and get in on this game big time if we don't actually reimagine what we're talking about and put the health sector and these other versions of what as I say, the human face of it back up front. But and I would say that, going back to the language question, we're in the, I wish that the language of war that is being used was actually applied in terms of preparation. You would never send soldiers into the field with flip-flops. They have boots, they have gear. Where is the gear for our frontline health workers? Right? So we use the language of war, but we're not actually backing it up in practice. And at the same time, we have these securitized responses coming into the mix, which is basically exacerbating the problem and actually not dealing with the reality on the ground. And you can, it's corporate interests. There's absolutely no doubt that they have a huge role in this.
There's a question on Facebook which I think is pertains to this. So there's from Francesca De Antoni. She's Italian, and she says in Italy apparently they have been suggesting that health workers that die from this disease or from working in hospitals dealing with this disease, they should be given the same treatment as people who die in war. Mm-hmm. So she does recognize that this has sort of implications for security using the securitization of the language, but what do you think of this idea?
So I think it's interesting, and again, something that I haven't necessarily picked up on this far in this outbreak, is that during other outbreaks, we've seen this concept of danger money being given to people working on the front lines, the burial teams in Ebola, the people doing the vector control in Brazil. And I'm wondering whether frontline healthcare workers are being given danger money, like you might be as a soldier, right, being deployed, and you kind of get a boost because you're in the front line of the war. I don't know if any of the panelists know this, but I know that answer, but that's something I'd be interested to hear.
In this question of, sorry, go ahead, Naila.
I was going to say, one of the questions that has come up here in Britain is that I think the government has decided to give something like 60,000 to the families of health workers who died. And now, of course, other frontline key workers like bus drivers, many more bus drivers are dying. And it's how you start, dividing and selecting one group of frontline workers over another when they're all. So I think it raises a lot of questions about.
Just to add, in Iran, they decided to say that health workers that die because of this will be treated as martyrs, which is basically people who serve the state, and there's a whole slew of benefits that their families get in perpetuity, actually. So there is that shift. But frankly speaking, I'm like, can we not prevent the deaths? I mean, we should be preventing the damn deaths, right? It's not that, okay, come and do it, and then we'll put your name on a wall. That's not what people want. That's not what they want for their families. And going back to the gender dimensions and the implications of this, as we see, first of all, as we see men dying, there are going to be whole sets of legislative issues. That what are the inheritance laws? What are the title deed issues? And all these kind of property rights in terms of their wives and their families being able to sustain their livelihoods going forward, where you have men dying. Similarly, where you have women dying in families, the trauma that comes with the mother going and what happens to the kids, and is the father going to go and remarry? These are things that we see in war settings, we see it in conflict settings, and it adds a whole layer of complexity and difficulty in terms of people's lives. But if you have the legislation in place and you can anticipate it, which we can, we should be able to do a better job of it preemptively. But again, the question is, do governments care? Are they willing to see it? And is the international community, the UN and the World Bank, do they even have the capacity and the skills within themselves as their advisors to be able to integrate this? Because that's another piece of this problem. That the World Bank may become a big player, but how good are they on gender and crisis? They haven't been that great in the years that I've been looking at it.
Maybe Maya Raphael, are you on?
Yeah, I'm here. Hi. Yeah, I was just curious with this new discourse of essential workers, which include a lot of previously undervalued laborers like care work, nurses, midwives, supermarket workers, whether you think that this will kind of change the way that we value care labor in society, or is it just empty rhetoric that after this crisis will continue the same way as it was before?
Okay, so the question, you got the question right. When will we? We have touched on it earlier, but you want to come back to it? Is there? You are the one, Naila, who emphasized these use of terminology of essential and non-essential. Do you think will there be any lasting impact from this current usage?
I think this is rhetoric, right? But behind this rhetoric, there is a real division, and we're recognizing it. So for once, there's some solid evidence behind the rhetoric of essential, of what is essential. But again, it could go either way. And it really, none of us can predict. But I think one of us said that, is it really possible for policymakers, especially in Britain, who have treated the National Health Service as an orphan child, who have deprived it of resources, have now asked people to come back from retirement to pick up the battle, have suddenly recognized that migrant workers are making these huge contributions to the National Health Service and dying in their service? Will it be possible to go back to just treating them as low-skilled, dispensable people at the end? I don't know. It's a question of politics, and it's a question of what we, the international community and local civil society, do. But it would be heartbreaking to have lost all these lives by people who went so unappreciated all this time. And suddenly we're recognizing their importance. And it would be heartbreaking to go back to business as usual. So, I don't think any of us can predict what's going to happen. But, there is going to be attempts to try and claw back some of the money that's been spent. on bailing people out, on bailing small business or whatever it is. And we've already heard from the Chancellor, this is all going to be paid back. But the question is, who is going to pay it back? And that's why I go back to them. There has to be some kind of redistributive mechanism so that it's not just, and a redistributive mechanism that makes sure that this care work remains essential and remains seen as essential. But beyond that, I think we cannot make predictions.
Can I just
to jump in on? Oh, sorry.
Yes, sir, go ahead.
No, just a quick thing to follow up on what Nyla was talking about kind of what the government does next. I think it will be really interesting to see is where bailout money goes to. Because we know after the last crisis, and admittedly it was a financial crisis, it was mainly male-dominated industries and sectors which were bailed out. I think we will now need to ask who's going to get the priority bailout, because there's going to be a finite amount of money. And, is it going to be the banks and the male-dominated manufacturing industries, or is it going to be other industries which might be more female-dominated, right? What about care workers in the private sector? Are we going to see redistribution of what is valued and what the governments think are important for the working economy?
So just two thoughts on this. One is that I feel as if we've been in an environment where we've been sort of playing past the parcel, but instead of unraveling the paper, we've been adding to it. So it's kind of like this ballooning of PR and all these kind of, at the core of it, there's something essential and really important going on. And then whether it's the national healthcare or other systems, it's been layers and layers of other sort of types of work, which actually get paid more than the core. And I think we need to reverse that trend and get back to saying, who does matter? The nurses, the cleaners, the bus drivers. I mean, these people, without them, the people who are doing our sewage and our electricity and our Wi-Fi systems and things like this is where, this is essential, right? So really thinking that. But it's related also to the media, because if you think about it, over the last, again, 20 years, certainly, we have become so sort of accustomed to assuming that the Kardashians and reality TV and all these are the celebrity culture, right? But who are these people? They're completely useless. Why can't we reshift that and actually elevate genuine community heroes, genuine people who are doing phenomenal work and are fabulous? I mean, just think about that cultural shift in terms of what we value. And then if you have that in the ethos, then that in itself adds to the arguments that we have. But essentially, it's been invisible. And for the first time ever, we're suddenly seeing this sector that has been so, they're like the sort of the gnomes that were helping in the shoemakers factory. It's at night. All of a sudden, the light is on them, and we're realizing without them, we don't exist, the rest of us, right? So let's elevate that and get rid of a lot of the fluff that's been out there, and inspire people with real heroes as opposed to just kind of cardboard celebrity cutouts.
Thank you very much. And I think we have reached our time limit, unfortunately, but it's been a very lively discussion, and I don't think I've had such a lively chat room ever in one of these Zoom calls. And it is true, as someone pointed out, that there is clearly a majority of women on this call, but there has been a very lively discussion going on, and I think we can look at what we have taken away from this. I think fundamentally we are talking about biases. We are focused on the gender bias, but of course there are many other biases. I think what the gender discussion does is that it forces us to think about unconscious biases that we have, and how we can broaden our perspective and make sure that we don't work with this. And yeah, I think Claire's point about data, the critical, it's only once we really look at the data and do serious analytical work that we can fully reveal those biases that we have. The suggestion of having advisors in the design of pandemic policies that are focused on unveiling these biases and maybe particularly the gender bias seems like a very productive step. And having also, once we go into these pandemics, so much has been determined by how well we were prepared. And countries have been struggling with kind of improvising strategies because they lacked testing equipment, or they lacked ICU capacity, they lacked PPE resources and so on. You know, if there was a genuine system in place and that really had been tested from a women, peace, security perspective, I think we would have been in a better place. And I guess the last point I think comes out of this, and as always in these discussions, the importance of language and how we use it and what it conveys. And of course, we'll see how, you know, there have been some positive developments in this regard. So I think we have become more aware of certain contributions in society, and we are trying to acknowledge that in the language we use. So the big question is, as everyone's been saying, you know, will we change after this? But let's be hopeful that we will get some real change. I think there was a lot of suggestions in the chat room that, you know, let's follow up on that policy, let's follow up on that issue. And I very much hope that people will use this opportunity to continue discussing this, because it is only that way we can make progress. So thank you very much to everybody. It's been a very enjoyable discussion. Thank you.